back to the Dr. Greg Jones Optimization Academy, where I get to interview some of my favorite innovators in health and fitness and medicine and beyond. And we are welcoming back Dr. Grace Liu of the Gut Institute. For those of you who missed part one, stop what you're doing, go listen to part one. But if you have done the first part of this course of our podcast here, you'll know that Dr. Liu is a functional medicine practitioner. She is a pharmacist, a clinical pharmacist by trade, founder of the Gut Institute. As I said before, she helps her clients gain optimal performance through rebuilding the microbiome after damage from modern living. She's amazing. We talked about advanced lab testing and strategies to reverse. We talked about gut dysbiosis and the microbiome and all the different systems that it involves. And this is what she does and does it very well. So I'm very happy to welcome Dr. Grace back to the show.
Thank you so much for having me again.
You are welcome. I'm going to get one of those sound machines where it's going to be clapping and some fireworks when you guys come back on the show. I need to just really hype this up, because this is, I get so excited when I get you guys on the show, because we follow each other on social media and I see the posts and I see the presentations and the things on YouTube, and I'm like, oh my God, I'm going to have her on the show. And it's just amazing to have these conversations and just talk medicine and true medicine, right? We talked about dysfunctional medicine and functional medicine in part one. So it's exciting. So welcome back. Okay, so we're going to start, and I told her before we kicked off, like, hey, I'm about to ask you some questions that I don't really know a whole lot about. So this is all you. You are going to need some BPC 157 and thymosin beta 4, because your back is about to hurt, because you're about to carry this show. You're about to carry
I got it. Sure. Awesome.
So,
let's do it.
So in part one, we talked a little bit about modern living and diet and how that can affect the microbiome, right? So inflammatory foods and processed foods and all these things we know that are just unhealthy and not having enough fiber, right? But we also know there are all these diets, and every few years a new one comes out, right? There's this paleo, there's whole food, there's the macro diet, there's all these, low carb, keto, et cetera, right?
Yeah.
And so the question for you is, are these diets sufficient to fuel our microbiome in the short term and for life? And do they actually help heal the gut? So I definitely want to get your take on the diets and how they help us or not help us.
Absolutely. So that's when testing actually can be really helpful. I mean, most people who grab onto a diet, they're doing it because they have some health issue, whether they admit it or not, memory loss or like body fat composition, brain fog, fatigue or autoimmunity or a cancer diet to go into remission. So I look, it's important to look at why they're on a diet and then look at markers. What we have seen for me is when I pull organic acid testing or a stool kit like GI Map or a Genova stool kit, is I can track and kind of look at how permeable their gut lining is. No matter how good a diet is, if they have high permeability, so in other words, like a lot of lipopolysaccharide, which is really toxic for our system from gram-negative bacteria, and just a lot of permeability, no matter how good they're eating or what diet they're on, they're going to be allergic to it. Because whatever they're eating, the undigested proteins and other things, and what's ever in the gut, yeast, pathogenic flora, they go into the bloodstream, and the body's just like, no way, here comes in the CIA and targeted shooters and drones and blah, 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 bring in the whole cavalry, Army, Navy, Air Force, everything. And they'll try to move it out, move what's leaking into the bloodstream. And that's when we start to see a lot of health problems. It could be brain fog, body comp issues, metabolic syndrome, overweight, diabetes, hard gainers for athletes, poor performance. Some people are not medaling or ranking or getting on the podium. Their performance is starting to suck. For MMA fighters, like they might get concussions, get hit, all that kind of stuff. So diets are helpful, depending on what's going on. A lot of diets may initially work, in the beginning because they are starving certain components of the microbiome. Most of our pathogens like yeast, candida, some mold, the high, our gram-positive and gram-negatives that are really pathogenic like E. coli and strep, these tend to be sugar eaters. Klebsiella, Citrobacter, all are really highly, inflammatory. They affect joints. You work on a lot of ortho and joints. We find, chlamydia and Klebsiella, Citrobacter, all these junk they have antibodies against synovial tissue, knee tissue, all kinds of joint, and even like OA, hand, phalanges, and other, problems that develop. So when I look at what helps someone for their diet, it's usually because they're starving some huge component of their microbiome. But it's not forever. You know, as soon as they lick a strawberry, right, eat a piece of bread or eat candy, it's all going to come back again. That's what they always tell me as well. You know, I don't care what kind of fruit cleanse they do. A very popular one's called AIP, autoimmune paleo diet, which is great. But we've seen so many failures of people that come to us, you know, oh, as soon as they eat carbs again or whatever, all their symptoms come back again. These diets also starve. Many of them are low fiber. Like paleo diet, I love it, but it's probably like 3 grams of fiber a day. You know, romaine lettuce you get 1 gram of fiber for 1 cup of romaine lettuce. I don't care how much lettuce you eat, you know, like a rabbit, you're not getting much fiber. Lentils, on the other hand, is about 12 grams for half cup. Rice, if you have good stomach acid, you don't have achlorhydria, you don't have a history of problems with NSAIDs, ibuprofen, or PPIs, or H2 blockers. Let's say you have a really great gut, you know, you're making plenty of acid. Acid transform carbs, complex carbs, into something known as type 3 resistant starch, which is an amazing fiber that's kind of gooey, and it feeds all our mucolytic fermenting bacteria, our protective firewalls. Our protective firewalls eat mucus. They're like right up against our whole GI tract, small intestinal tract, and they heal us. They turn on peptides probably. They secrete a bunch of peptides. They make all kinds of antimicrobial peptides known as AMPs. Some of these AMPs are circular. Some are huge, like anti-Lyme, anti-spirochete, anti-strep, anti-candida, antifungal type of peptides. They're amazing and super cool. So and then when we feed them, they live for us and make all kinds of stuff. And studies show for low carb diets, big components of our keystone flora die off. Generally, when they resume a normal diet, not a low carb diet, they come back again, but not always. We know with antibiotic studies, after 1 course antibiotic, some people will actually never grow back what they lost with the antibiotic. Some they will, but it will take 3 years or 2 years. All the studies are different. It kind of depends on the patient population.
Amazing. It's amazing. Now, you mentioned that permeability, and I started thinking, like, we did not talk about this in part 1.
No, yeah,
you know, and it's leaky gut, right?
Yeah.
And so we talk about gut permeability, we talk about leaky gut, right? And so, and that begs the question, since we're on the topic of diets, is there a diet that is, you know, more specific or for healing of leaky gut? Or, you know, because again, you know, you get these gap junctions, you know, they're, you know, permeability, you're getting proteins and your body's attacking it, right? And so from this is gonna be high level, this answer here, but what's a good strategy to kind of help, you know, that leaky gut repair?
Yeah, so we have a master gut class. We teach people how to have the best diet for themselves. It should be rather customized. So it comes with a free kit, an O kit, an organic acid tech kit, and an IgG food panel, which is super awesome. I love the one from Great Plains. Partly I love it because there's also, they check, just like we check titers and antibodies against Lyme or any of the viral co-infections, you know, cytomegalovirus, HHV6, HHV7, HHV8, parvo, you know, Epstein-Barr. This food allergen test checks antibodies against the 2 major fungal elements in the gut, which are often on skin and brain and that vagina, you know, microbiome areas as well. And I love to track these because the higher they are, the more fucked a person is, because you shouldn't be making antibodies against your own flora. They all belong there. They're native, they're endogenous, they're part of the terrain. They're part of a good rainforest in the gut. The problem is if they're leaking into the bloodstream, then the body's gonna try to attack it. This is just a natural, amazing immune system we have. Unfortunately, whatever someone's eating, and these also, if they're overgrowing, they're causing leaky gut. They break down firewalls. That's why but we don't want to just be on antifungals forever or anti-strep medications forever. That's why some people, they take antibiotics, they do feel mildly a little bit better. But the best thing is to have targeted probiotics. That's what every healthy human has. I call them the ABC. So we actually can check stool kits and check if people have these. A is for Akkermansia, B is for bifidobacterium, like in my probiotic. C is for the butyrate making Clostridioides. The C is for Clostridioides. Everyone should have a healthy amount of these, not too much. It's like Goldilocks. Too much is not good. Too little is not good. Too much actually means you're having overgrowth and a lot of leaky gut. Yeah. So the ideal diet, like what I talk about in my master gut class, is what shows up on the allergen test. And surprisingly, people will be like, oh my God, I eat avocados all day long. Why am I allergic to it? Well, that's because you're leaky. And now you pushed it into your bloodstream because you're leaky. And also a lot of people, they don't know why they're leaky. Well, stress causes leakiness. Like, let's say they're around toxic people, toxic environment, toxic job, toxic neighborhood, toxic people, toxic family, thinking toxic thoughts, right? You actually kind of have to, we have to look the whole spectrum, psychosocial lifestyle. Sometimes the best thing for someone is to get a spousectomy or a jobectomy or a cityectomy, because something there, they're not aligning to it, right? And they think like, oh, I should just stay here, do it or whatever, but they're actually creating leaky gut because that stress is relentless. And then the body knows it, right? Trauma gets stuck there. And that's why I actually love other modalities of healing that are ancestral, are kind of used forever, like psychedelics and mushrooms and ayahuasca, all kinds of stuff, because it's not that easy to do those things mentally sometimes. But we look at all the reasons why permeability is happening. Sometimes some of my clients, like, oh, they're lovely people, but their hormones are tanked, their testing is tanked, and they're doing CrossFit 5 days a week. Holy cow. Now, when I had chronic fatigue, if I did CrossFit, I'd be in bed for 2 months straight afterwards. In fact, I did. That's what happened. Also, I did Bikram. I had a 10-part card. I did Bikram twice. I could never go back. I sweat so much and I wiped out all my sodium and potassium and zinc and boron, everything. I couldn't even like function for like freaking a month or two later. Like, so we have to kind of ask our clients, like, what are you doing? And kind of scale it back. They think it's okay, but it's actually not okay. And it's causing permeability to the point where they're allergic to every food they're eating. But with our protocols, changing lifestyles a little bit, healing, nourishing themselves, nourishing their heart, why don't they feel love for themselves? Damn it, start feeling love for yourself. That will heal your leaky gut. Yeah. So we have some, training and help them feel safe. Oh my gosh, all these turn on our vagal nerve and our nervous system will be like, yay, and heal the leakiness. And actually, even if we don't restrict foods, people can suddenly eat foods that they're allergic to. And oh my God, their gut pain doesn't hurt anymore. We even do zappers like a gamma cord to zap their vagal, a couple times a day, just to get the vagal nerve up. And that will tighten actually the esophageal sphincter, even tighten the gut up. The founder of gamma cord is amazing. He created it, I believe one of the co-founders, he created it because his son had an anaphylactic peanut allergy. Yeah. So we all develop allergens for some, in some way, shape, or form through modern living, modern disruptions, and the lack of our keystone flora that tighten all of it up and even turn on the immune systems so that it's normal, no allergen state. And then, we don't have to do so many of all these other things, protocols and everything, peptides, hormones, it's our nervous system. A lot of it's regulated by the microbiome. The diets are helpful temporarily. I mean, we do have people consider, cutting back on the top allergens that show up on all testing. So basically it's gluten, dairy, nuts. Yeah, nuts are lovely, but they're also really high protein, sticky proteins. For some reason, soy and corn are terrible. They're probably because they're GMO right now. And BT corn is terrible. BT is a toxin that kills pests, but unfortunately it's a gut disruptor, kills our guts as well too. So those are the main, things we kind of sort of take away temporarily. If someone has Crohn's or IBD, we actually will have them consider cutting out the protein they're eating and then modify their protein in their diet. If they're high protein carnivore, we actually have to switch them to vegetarian temporarily. If they're just, normal eating, we have them do 1 week red meat, 1 week poultry, goose, duck, chicken, turkey, 1 week fish, trout, salmon, halibut, whatever, and then 1 week seafood if they're not allergic to seafood. This, in just a month or two, they're usually able to start to eat foods again, and especially with our gut protocols, calming down the gut, maybe a couple peptides as well, like really fast recovery. Like people are just surprised and shocked. And then like we were talking about different metrics, I ask people about their, for women, PMS and cycle length, are they still achy breasts, acne, anxiety, bitch, like, are they still like that? If they aren't, oh my God, we know we did it. Men, are you still, cranky, road rage, low testosterone, no morning wood. And then in 2 months or less with this change and, gut protocols that hit what's really going on, like fungal overgrowths, yeast overgrowth, strep overgrowth. Oh my gosh, like everything's back again. Testosterone may actually not really even change. I think there's something going on at the biological receptor level. Our microbiome pathogens secrete out poisons that block a lot of receptors, thyroid receptors, so our temperatures go down, right? Testosterone receptors. So levels look fine, but they're blocked, cock blocked, in other words. same with women, you know, progesterone. And then we talk a lot about stress because you know a lot about aromatase. You know, stress is going to, whether it's high or low, the dysregulation turns on aromatase. And we know genetically and anatomically, some women have high aromatase activity in their lower abdominal tract, but not much elsewhere. The problem is with high aromatase is we get this imbalance of hormone when stress turns on aromatase. So there's high estrogen locally. We don't detect it in the blood, but they're pumping the fuck out of estrogen there, and they're causing hyperproliferation, kind of like scarring, adhesion. So then you're looking at cysts and fibroids. And again, with our protocols in just 2 months or less, often we'll see these cysts and fibroids just disappear because we're changing the microbiome and the whole terrain. And then the body starts to resorb things that don't belong where they are.
And it's interesting what you mentioned about the testing portion of it and being allergic to foods, because I'll get patients who they'll have their food sensitivity testing, and they'll be like, it's 40 things, and it's just like, well, you're not allergic to 40 foods. You got leaky gut. Like, this is impossible.
Yeah, right.
Like, you wouldn't, this is because you're literally those, that permeability is so bad that almost everything you eat is coming out there. So I can't tell you, well, don't eat, because if you take away everything of this, what are you going to eat? You know, so we actually kind of, because when we're trained naturopathic doctors in our school, we kind of have our basic protocol. We do the 4 R's, where it's remove, restore, reinoculate, repair, right? So you want to remove the offending pathogen, which is like, okay, that food or that that you're responding to. Okay, so if it's 40, all right, okay, we take the top, and we can do rotational diets wherever we need to do, and then you talk about reinoculating. That's getting the good gut, that resolving dysbiosis, good gut bacteria versus bad. And you got your replace. This is the the thought process of most likely there's some type of digestive enzyme deficiency, and that varies on the school of thought on where you stand on that. And then also repair, and that's where there's so many great products out there. Obviously, I love peptides, so I'm going to think about like DPC-15. We'll talk about. I don't want to like steal the peptide thunder for the end, but there are peptides that can help repair the gut. So you got your BPC-157, which is probably top of the class with that. But even if you're not about that peptide life, and if you're not, why are you listening? Hang up the phone, get off the podcast. So but then if you look at supplements and all that, you'll have your L-glutamine and carnosine. There's just a ton of different things that can help with that healing piece of it, right? And so and then there's I want to say glycerizoles on it. There's a list of all these great gut healing things out there. Slippery elm, yes, exactly. So some more of the demulcent herbs and all that stuff. So you got all these great things there, right? But at the end of the day, it's like recognizing that, hey, if you have you ran zonulin testing before, or
we'll add it on to the GI stool kit sometimes. But again, like you've seen, some people have testing, and none of it is like ideal. Like, it's all kind of the immunoglobulins on the food panel, or their Lyme testing, or their Epstein-Barr, the IgGs are all low. And oh, sorry, Greg, I gotta probably change out. Oh, I have to change this out. I should.
Not yet. Nope, can't hear you yet. I think you're muted. Nothing yet. Let's see here. Uh-oh. Oh, that's one. Okay, so another thing we mentioned a little bit in the previous show, and we talked a little bit before we got on here, was we know that we live in this very toxic environment, right? So we all these hormone disruptors and gut disruptors and microbiome disruptors, right? And you mentioned the firewall, right, with the gut. And so, are there any particular strains or particular microbiome components that are very specific in that firewall against these toxins like xenoestrogens and arsenic and other heavy metals?
Yeah, and that's an awesome question, Greg, because we deal now with this toxic soup, all of us, no matter, even babies born, as you know, their cord blood is just shown, studies show they're just full of like over 100, 200 different chemicals, right? So from birth, it's, people are inundated. So I actually did a keynote address for the AAEM, the American Academy of Environmental Medicines, who help heal people with all kinds of toxin burden, xenoestrogens, phthalates, chemicals, plastics, heavy metals. And surprisingly, when people have a healthy microbiome, the bacteria that are there, like bifidobacteria longum, Lactobacillus rhamnosus, these have been heavily studied, these two species. They actually help in vitro, they're mostly in vitro, but I'll talk about in a second an in vivo study. Most are in vitro, and they find that these bacteria, their cell wall will absorb up heavy metals, take them out of the system. They even bind up mycotoxins. So, I mean, we have this rampant mold toxicity issue. I mean, yeah, the homes are hyper hermetically sealed, and without airflow, mold's just going to grow on dust particles, no matter what we do. But we have a huge problem now with mold. People have antibodies to mold, they're full of mold, and they don't have the good flora. Basically, I think it's the same firewall theory, right? They don't have the firewall to neutralize mycotoxins and literally be anti-aspergillus. So when we do protocols, we do botanicals and some binders, that are anti-aspergillus, which is different in pharmaceutical activity, pharmacological activity, compared to anti-candida activity or anti-Saccharomyces yeast activity. You have to do aspergillus activity. They're all part of the fungi world, but different things kill them. So the in vitro studies are amazing. And even for other chemicals, these species can neutralize toxins. For estrogens as well, too, we need these good ones to transform like an orange, antioxidant known as nerinogen. There's a lot of nerinogen studies. If you don't have the composite of healthy flora in the gut, you don't make amplified antioxidants from the food we eat. I mean, food has lots of antioxidants, but some, what's shown in clinical studies is that they're very powerful, but you need this augmentation, from our gut microbiome, a healthy one. Yeah. So again, I love looking at, centenarians. They have certain species, especially Eubacteria limosum. They have 7 times more Eubacteria limosum. And this species, compared to healthy control people at the same age match, this special species will take regular antioxidants in food and just amplify the F out of them. And a lot of these antioxidants, they help combat xenoestrogens, basically, the inflammation related to toxic chemicals that are in the body. And then when we have good stooling, we'll bind toxins up and then they exit our body, really in a healthy way. And that's how, okay, let's bring back to peptides. A lot of the rodent, mouse, rat studies done with BPC as well as TB4, thymosin beta-4, they gave all kinds of toxins to these animals. And when the peptides were on board, they were bulletproof. They didn't get toxified. They gave lethal doses of like all kinds of toxins. Some are gut toxins, others were just lethal toxins like arsenic or other heavy metals. They were able to live and also remodel their body to a state very close to healthy homeostasis.
Wow.
Yeah,
That's
and even
amazing.
antibiotics. Yeah, they even gave yeast infections to little rodent animals with BPC, and they didn't get paretic. They didn't get fever. Like they were probably combating, the infection.
Oh man.
Yeah,
That's
so
so
they're
cool to see that.
antimicrobial
Yeah.
and they're remodeling the soft tissue, and we know they help bone too. Bony tissue is and joints and
Nice.
yeah.
Nice. And that leads, what a segue, a perfect segue, because that leads into our last question. Now, this is my new thing with my guests, especially those who are in our peptide world. All right, here we go, Dr. Grace. You are going to an island. You didn't plan to get stranded, but I'm stranding you on this island.
Okay.
And you get to take 3 peptides with you. Just 3. You can make a combination one. I won't be judgy on that. But if you had to only have 3 peptides with you, which ones would they be?
I think I would like the KPV. I think it's very teeny tiny but powerful KPV, and probably BPC and T beta-4.
Okay.
I love these. Yeah.
So those are
And
your
I
3.
love it. Like there's no lethal dose, and we try to kill animals with it. They just got healthier and healthier and healthier. That says a good thing about them. We can't do that with pharmaceuticals. Yeah.
Okay.
But the cocktail, is amazing to combine. You get the synergism, just like probiotics. When you get a diversity of our, good keystone flora, there's a synergism. You don't have to use as much either to get that amplified effect.
Now, why those 3?
Okay. So these are the ones most studied. So I believe they're safe and they're efficacious. KPV is a kind of a newer player, I think. I'm still learning a little bit about that. But KPV, I was doing a little experiment myself. You know how we always experiment ourselves. But I had a little wart on my eye, and I was not very even compliant. I just dabbed like a teeny bit of cream, KPV cream, like a few times in a month, and like that wart just fell off. Yeah. And I'm trying to get some skin tags off too. I have this in this eye, I have myelination on my optic nerve. You're not supposed to have that much myelination once the optic nerve enters the whole retinal orbit, whatever. So every time I go to, eye school, optometry school, they just want to take all these photos of me. But so I have some skin tags, and blemishes because there's inflammation there for whatever reason, right? That myelination changed something, probably not full oxygenation or whatever. So I have more skin tags on this side. And that's the same we see with people with cavitations, which are little pockets of yucky putrid bacteria after a wisdom tooth's been taken out or a tooth fell out, right? Or people who have silicone implants, a lot of garbage on that side of the body kind of thing. So there's some inflammation on this side versus this side for me. But the KPV has it's changing stuff powerfully.
Oh, wow. It's amazing. Yeah, we've done great work with KPV. I mean, just nasal spray for if there's some type, dealing with people with brain fog from mold toxicity, anti-inflammatory. We can use it just right near the site of an injury, just because it's so I actually prefer it, in office if I'm hey, I need to get this inflammation down right now. Because again, I love PRP, I love prolotherapy, I love all these regenerative injections. But if I need to get that inflammation down right now, I'm not reaching for a steroid, I'm reaching for KPV.
Ah, that's so awesome. Yeah.
It's that level of reduction of inflammation. So in BPC.
I love that. I love your experience and you're sharing it. That's so,
it's great. It's great. And to me, my favorite peptides are the ones that I can do the most with, because KPV, we can do in capsules, injectable nasal spray, BPC 157, eye drops, and oral capsules and injections. And in terms of
Rectal enema, yeah, rectal suppository enemas, yeah, anywhere we
toothpaste,
need it.
toothpaste,
Oh my God, yeah.
you can do BPC and 157 and a toothpaste, thymosin beta 4. Again, we
Right,
can work with
right.
that. And BPC 157 can also be a nasal spray too. And I
Yeah.
actually did a protocol for a
Okay.
TBI concussion recovery with
Yeah,
BPC. So great for that. And
that is
I actually,
fabulous.
I think we did NAD, BPC,
Yes,
and
yeah.
CMAX in that combo.
C-Max, perfect.
Combo.
Yeah,
So just
awesome.
that flexibility, and thymosin beta 4 is just such a
Yep.
great, we think about healing,
Yeah,
but thymosin beta 4 actually helps modulate the immune system too.
absolutely.
So if you have someone in that their immune system seems a little bit aggressive,
right,
you can actually calm it down a little bit using some thymosin beta
right,
4. And that's just the function of that is just amazing and topical, and we can use it for
right.
hair. I actually
Yes,
did a conference, and it was the hair regeneration was a topic, and they
yes,
mentioned
right.
doing BPC 157, thymosin beta 4, and GHK copper in the
GHK copper, I
scalp.
love that one. Yeah,
In the
I got some
scalp.
baby hair growth too using
Oh
on
man,
my
it's
scalp
great.
line,
It's
and
great.
yeah, I know. It's
Doing
right.
that.
Well,
So
I don't know if since you work with athletes, the thymosin beta 4 is also in the I think they're getting human studies or phase three out because there's going to be a pharmaceutical indication, but in animals it helps to reverse and do protection for CTBI.
wow.
Yeah,
That's cool. That's man. I gotta look
yeah, and
into
it's
that
hard to
study
keep
as
up with
well.
all of it. Yeah,
Yes,
it's hard
always.
to keep. Yeah,
So
but
it's how you
anything
learn
that
this.
helps the brain is going to help the biome, is what I found.
Yeah, the
And
only
that's the same with
downside.
BPC. BPC is shown also to help with CTBI in animal studies.
Yeah, I've seen
Yeah,
that too. I guess the only downside with our athletes is that it's still not, like it's banned in your competitive sports.
it's now banned January 1st, 2022, just recently.
Which one? The thymosin beta 4?
All of them, all the peptides.
Really?
Yeah, it's the
Oh,
WADA department, World Anti-Doping Agency, and
yeah,
IOC follows it, and MMA, UFC,
yeah.
and Bellator follow it as well.
They
Yeah,
have it.
which is too bad. BPC can
I
be detected in
know.
the urine. They'll
I
probably get
know.
the other ones detectable too.
Yeah, and it's unfortunate because it's
We make
healing.
it. I know we make
You
it.
literally make it. You literally make it yourself. We make
Yeah,
thymusins. It's
right,
just it's
right,
embarrassing, but it
right.
is what it is. So we have to see. All right, when they retire, then it's like, hey, I got you. We'll put you back together when you're retiring. You're not in this testing pool. So this was great, and I appreciate the time, and I've learned so much here through part 1 and part 2, because before we got on here, I was like, I'm gonna be real with you, man. Like I love the gut, and I'm still learning more about
Yeah,
it.
yeah.
Beyond the surface of here's here's some magnesium if you're constipated, and here's some some zinc carnosine, and so
Yeah.
getting into when probiotics are appropriate, what strains are appropriate, and then there's I didn't even I got to drop this one on you here.
Yes.
Prebiotics. What are your thoughts on prebiotics?
So as you know, I mentioned the mucolytic mucus fermenting bacteria, Bifidobacteria longum and Lactobacillus rhamnosus are some, and a lot of the, butyrate making Clostridioides, the ABCs. I like fiber that's gooey. So that's like glucomannan, and you don't need a lot, a little bit of glucomannan, like half a teaspoon. You got to dilute it in 2 cups of water because it'll become a concrete block, and swell. And that's why it helps satiety, gets our GLP-1 agonist receptor going, and fill us up. I mean, in the old days, we ate all kinds of underground tubers that were gooey, like taro, and even regular American potatoes do that as well. Beans, really swell up. All countries have fermented beans, like in Asia, it's fermented, a lot of fermented, soybean. I was looking at African fermented foods. They ferment all kinds of seeds and beans because they didn't have refrigeration. This is how we stored food, and it was healthy, with a lot of acidity and complex umami flavor. So I like the gooey fibers. So also psyllium. Psyllium's a little harsh if someone's using it for inflammatory bowel disease. I would avoid it until they're stable. But those are the basic ones, just those 2. And also inulin is powerful. It's a little sweet, but it's carbs for our flora. There's no nutritive value, no calories for humans. It's carbs that feed our gut flora. And also now that came out in the market, you just need a few grams, and it's expensive, but it's called human milk oligosaccharides. So they come literally from breast milk, but they're synthesized. So human milk oligosaccharides. These optimally get our immune system on board, because as babies are born, they don't have an immune system. They're getting only mom's maternal IgGs. You can with the human milk oligosaccharides really shift disease because you're feeding the right flora. Yeah.
Mhm.
And then in terms of species for probiotics, this is one thing I forgot to mention is like we avoid all strep probiotics. They're really cheap. They're food-based. They're not really human endogenous to human being microbiome. And a lot of people who are anxious or they have food allergies, they usually have antibodies to their own strep, and it will cause a problem at some point, even a small
Wow.
amount. So we avoid that temporarily. Just like if someone shows up with antibodies to gluten, we're not going to do gluten, until maybe 4 or 6 months later of healthy changes. Same with Saccharomyces. So I love the food allergy test from Great Plains. Everyone has some degree of allergies to their own Saccharomyces, again for the same reason. They're leaky and there's Saccharomyces everywhere.
Oh,
And
nice.
when we add Aspergillosis, it's problematic. It's just like adding gluten to someone who's gluten or gluten allergic. You're going to trigger their immune system to be a little haywire. I mean, I do love the peptides and the protocols we have. They help to mitigate all this a lot faster, so we can do these things later if we want. But again, so Aspergillosis was found on lychee plant because it prevented lychee, which grows in the tropics, from getting moldy. It's a great probiotic, but it's not really native to humans. Saccharomyces boulardii, yeah.
Nice.
It's lovely, but not part of human. And it could, we may have also antibodies to it until someone has calmed their immune system down, like you're talking about. If it's like crazy,
Mhm.
overactive.
Nice. Incredible stuff. And I'm excited to continue this conversation and learn more at the Gut Institute, because I'm probably going to learn some more. I want more of this information. So I'm like, I need to
Cool,
get
let's do it. Yeah.
I need to get on this. So that being said, Dr. Grace, we're going to let you go so you can enjoy the weekend. And I believe you're in the Bay Area.
Yes, I'm in the Bay Area.
Okay, get to enjoy that. I don't know if the weather, we're recording this in the beginning of March, so I don't know what the weather is like out there, but soon it'll be amazing. It'll be
Yes,
amazing.
exactly.
So that being said, where can we find you for those who didn't listen to part one?
I'm at thegutinstitute.com, and you can also find us at Facebook, the Gut Institute. And we love to do little trainings there for both clinicians and coaches, as well as really, high level consumers and people who want to like up level their health. We're here for you. Anything related to poop.
Okay, all things related to poop, which is a naturopath, man. It's like I spend a lot of my day asking about bowel movements, more so than I like to admit. That being said, I want to wish you the best, and we will talk soon. And I probably will see more, not probably, I will see you at conferences in the future, because I think we keep running into each other and learning more, and that thirst for knowledge. And so that'll be it for this time, everyone. We look forward to our next interview with Dr. Grace. Everyone out there, stay healthy and safe, and we will talk to you and see you soon.
I learned so much from you, Dr. Grace. Thank you. Thank you for all that you do and all your magic. Thank you.
Oh, thank you so much. I appreciate that. All right, bye.